LSD is making a surprising comeback as a potential breakthrough treatment for anxiety disorders. Once infamous as a hallmark of 1960s counterculture, lysergic acid diethylamide, more commonly known as LSD, is now being reconsidered by researchers looking for new ways to alleviate anxiety. But here's where it gets controversial. This isn't just about recreational drug use. It's about a potential medical advance that could change how generalized anxiety disorder, GAD, is treated. Recent preliminary findings, published in the respected medical journal JAMA, reveal that a single dose of MM120, a carefully formulated oral LSD medication, can produce significant improvements in anxiety symptoms. This development could present an alternative to the standard daily medications many patients rely on, which often come with persistent side effects. Of course, experts urge caution. Early trial successes don't always translate into reliable long-term treatments when further testing takes place. Dr. Maurizio Fava, chair of psychiatry at Mass General Brigham and a professor at Harvard Medical School, highlighted the potential benefits of MM120 by contrasting it with current therapies. All existing treatments for generalized anxiety typically require daily doses, which means daily exposure to side effects, he explained to ABC News. Here, a single dose triggers side effects mainly during the day of administration, yet the calming benefits extend for weeks afterward. Dr. Fava, who advised MindMed, the trial's sponsoring company, mentioned he does not receive personal funding from them, emphasizing the integrity of the research. Supporting the study's quality, Harriet DeWitt, Ph.D., a psychiatry and behavioral neuroscience professor at the University of Chicago, praised its meticulous design. This was a robust study involving 4 different dosage levels, in addition to a placebo group, with a well-balanced number of participants, she stated. The investigators are highly skilled in clinical trial methodology, and the results were striking. The study enrolled 198 adults experiencing moderate to severe anxiety from 22 sites across the United States. The participants were given either varying doses of MM120 or a placebo, with their anxiety symptoms monitored over a 12-week period using standard measurement scales. The most notable improvements were seen with the 100 and 200 microgram doses, where participants saw symptom reductions approximately 5 to 6 points greater than those given placebo, lasting up to 3 months after just 1 dose. Dr. Fava pointed out an important nuance. The study's design, in which participants knew there was a 75% chance they would receive LSD, possibly heightened the placebo effect, making it harder to demonstrate a clear drug benefit. Despite a strong placebo response, the higher LSD doses still showed a clear and significant advantage, he noted. And this is the part most people miss. Unlike many psychedelic studies, this trial deliberately avoided pairing the medication with psychotherapy. This is unusual because psychedelics are often used alongside therapy to maximize benefits. What makes this trial remarkable is that it did not involve intensive psychotherapy, Dr. DeWitt remarked. This suggests the medication on its own has substantial and lasting anti-anxiety effects. Regarding side effects, higher doses produce temporary effects such as visual distortions, mild hallucinations, nausea, and headaches. Serious adverse events are uncommon. Every person who received the 200 microgram dose experienced some perceptual changes, Dr. DeWitt explained. Whether these experiences contribute to the drug's beneficial outcome is unknown, but they weren't necessarily harmful. Yet, the long duration of LSD's effects, often lasting 8 to 12 hours, poses logistical challenges for clinical application. Dr. Fava warned, "For safety reasons, I strongly believe that psychedelic medications should be administered under professional medical supervision, not at home." For decades, LSD was primarily seen as a dangerous hallucinogen, but perceptions are shifting as accumulating evidence points to potential medical benefits. It is truly impressive that a single dose can have lasting effects for 2 to 3 months, Dr. DeWitt said. However, these participants were selectively screened for safety, so we need more data about how this medication performs in the broader population. Dr. Fava stressed the importance of conducting larger, more comprehensive Phase 3 clinical trials to confirm these early findings, trials that are already underway. Meanwhile, Dr. DeWitt encouraged more research in this field, remarking, "Studies like this one are crucial steps forward." So, LSD might be shaking off its countercultural stigma to become a modern therapeutic tool. But should a medication known for psychedelic effects become a mainstream anxiety treatment? Could the hallucinogenic side effects be a barrier or a necessary part of the healing process? We'd love to hear your thoughts. Do you see this as a promising breakthrough or a treatment path filled with challenges? Share your views and join the conversation.